Good afternoon. I'm Charles Lejano. This is One News Now. The government has launched a new campaign to emphasize the importance of discipline in the fight against COVID-19. To tell us more about this, we have Greg Gregorio. He's reporting live from Marikina. Greg, what's this new program all about?
Charles, authorities are highlighting the importance of everyone's compliance to minimum health protocols as experts are still working on a COVID-19 vaccine. As Russia's Sputnik V vaccine still has to undergo regulatory procedures, Health Secretary Francisco Duque III reminded the public about preventing the spread of the virus.
Hindi po natin pwedeng baliwalain ito kaya may bakuna o wala.
That's why the DOH has partnered with the Interior Department for the Bida ang May Disiplina Solusyon sa COVID-19 campaign. The program puts to task local government units to form a Barangay Disiplina Brigade to strictly monitor compliance with health protocols. This campaign was launched in Marikina, a city recognized for its response measures against the pandemic, from having their own molecular laboratory to their efficient contact tracing.
Nasusunod nila yung Mayor Magalong formula na 1 patient to 30 up to 37. Yun po ang sana magandang malaman ng lahat ng mga LGU sa buong bansa na kung nagawa ng Marikina, magagawa nyo rin.
Still, Marikina Mayor Marcy Teodoro admits that they have their work cut out for them as infections in the city are still on the rise. As of August 13, Marikina recorded 1,039 confirmed COVID-19 cases, 502 of which are active cases. Some areas in 3 barangays with high infection rates have been placed under a 2 to 3 day extendable clustered home lockdown.
Hindi natin nila-lockdown ang buong Marikina sapagkat nakikita naman natin sa ibang barangay ay single digit lamang yung kaso ng COVID.
Authorities are also calling on businesses to coordinate with LGUs every time they subject their employees to COVID-19 testing, either through rapid or RT-PCR tests.
At lumabas po may mga positive. Unang-una, wag nyo muna pong pauwiin. No, find a suitable isolation place in your place. Pangalawa po, i-report nyo sa LGU. It is the LGU who can help you. And it is the LGU who will then alert the barangay.
Starting Friday, those who violate health standards in Marikina will be given citation tickets and penalties of as much as 2,000 pesos. A mandatory community service plus a few hours of counseling. Charles, Marikina Mayor Teodoro will meet Labor Secretary Silvestre Bello and CHED Chairman Popoy De Vera next week. Bello and De Vera were tasked by the IATF to monitor Marikina's COVID-19 response progress. Charles?
Thanks for that, Greg. That was Greg Gregorio reporting live from Marikina. The Health Department is looking to exempt COVID-19 vaccines from Phase 4 trials. Health Undersecretary Maria Rosario Vergere says they will ask the lower chamber to make the exemption under Bayanihan 2. But speaking to the chiefs, Vergere clarified this is still up for the World Health Organization's approval.
Although i-exempt sa Phase 4, ay dapat aprobado po yan ng WHO. Ito po ay recognized by international institutions and reputable na mga regulatory agencies. Pangalawa po, kailangan po ito po ay gagawin pa rin natin yung pagmamatyag. Hindi naman po natin tatanggalin totally.
Meanwhile, the Philippine Council for Health Research and Development Executive Director Jaime Montoya said that around 1,000 Filipinos will participate in the clinical trials of Russia's COVID-19 vaccine. Speaking to 1PH, Montoya explained that higher risk groups, including healthcare workers and the elderly, may be the first ones to receive the vaccine.
Makikita natin kung tayo ay maganda ang response, ang antibodies natin, sandali lang ba, matagal ba? So maraming factors na pwedeng tingnan.
The Health Department reports more than 6,000 new COVID-19 infections in the country. That brings the total number of cases to over 153,000, nearly 80,000 of which are still considered active. 16 people died from the coronavirus in the past 24 hours, pushing the national death toll to around 2,400. More than 71,000, meanwhile, have gotten better, with over 1,000 new recoveries just today. The Philippine General Hospital recommends doing away with rapid antibody tests completely. Speaking with the chiefs on One News, PGH Director Dr. Gerardo Legaspi explained why the test is not helpful for screening.
What we found out is that the rapid antibody test only predicts 20% of those who were really positive. So
That low. Yeah.
that low. That means you're missing out on 80% who would have been positive.
We are pausing for a quick break. One News Now will be right back. You're still watching One News Now. I'm Charles Lejano. The SPMC in Davao City is in the spotlight these days for getting the biggest chunk of the PhilHealth's controversial IRM. For the latest, Gemma Vansenia reports to us live. Gem, what are SPMC authorities saying?
Charles, the Southern Philippines Medical Center answers questions as to why they received the biggest IRM from PhilHealth. An official explains that the hospital has been the agency's top contributor for the past several years.
It should be no surprise that the biggest hospital in Mindanao received the biggest share in PhilHealth's interim reimbursement mechanism. According to Dr. Ricardo Audan, the IRM was based on the hospital's contribution in the agency's income. That contribution had reached 1 billion pesos in 2017 alone.
Nagtataka kami bakit binigyan ng color yung pagbigay ng cash advance sa amin ng PhilHealth. When in fact, in 2007, we're doing good already.
The doctor also shed light on how the SPMC became a mega hospital.
Yung mga patient namin na walang mga PhilHealth that they are eventually admitted, we enrolled them as member of the PhilHealth and we expanded our services. The services is really not only from Davao City but also catering the whole of Mindanao. Kaya yung mga technology namin, mga equipment is really very sophisticated.
Audan expects SPMC to suffer should the government permanently scrap the IRM.
Ang PhilHealth, malaki masyadong tulong ng PhilHealth. So magsasuffer din kasi although merong sariling income din ang hospital, but of course, I don't think it can stand alone without the external help from other government.
People who rely on the hospital, especially in times of emergency, share the same sentiment.
Kining purpose, kay purpose man to nga mo. Kaning matanggal pa na siya mo, kaluoy may kayo nga mag-uumalan. O may mga trabaho. Muna nga ni kaabot mi dress.
Dako kayo ma'am, kay wala ko ibayad bisag piso, bisag karong lang na PWD ko, zero ko. Kay patient man ko ma'am, stage 4.
On Thursday, PhilHealth suspended the IRM amid the ongoing investigation on alleged irregularities in the agency. Charles, the SPMC received a total of 325 million pesos from the PhilHealth this year. The agency's office here in Davao region assures that there is no favoritism in the distribution of the IRM. Charles?
Thank you, Gemma Vansenia, reporting live from Davao City. Heeding the public's clamor and as approved by President Duterte, the Education Department has postponed the opening of classes to October 5. But Education Secretary Leonor Briones notes this will be the last postponement. Jenny Dongon tells us more.
The Education Department has softened its stance in the opening of classes, supposedly this August 24. DepEd Secretary Leonor Briones says President Duterte has approved calls to defer the start of the school year to October 5. Briones says this should give schools ample time to iron out kinks in their blended learning setup.
Areas outside MECQ are directed by DepEd to continue their orientations, their dry runs. We already have conducted more than 500 dry runs, and the delivery of learning resources so that we will be ready for the opening of classes on October 5.
The education chief admits that the modified ECQ in Metro Manila, as well as Bulacan, Rizal, Cavite, and Laguna, hampered the preparations of affected schools. DepEd knows that NCR and Calabarzon have the highest student populations. NCR wanted a one-week extension, while Region 4A asked the school opening be moved to September 5.
Mabuti nang magbigay tayo ng allowance kasi because of the impact on our logistical requirements and activities. Dahil nga skeleton force na lang ang nag-ooperate ngayon.
Briones says the declaration also covers private schools, but it will not stop classes in schools that have already opened. Some parents welcome DepEd's move. Aling Teresa says she now has more time to prepare for the blended learning setup.
Mag-aaral din ako kung paano. Kasi mahirapan ako paano ko ituturo sa, kunyari kung sa anak ko, hindi pa ako ganong bihasa.
Mommy Princess, whose child is enrolled in a private school, says classes have started but they are still facing hiccups.
Sana next year na lang nila ginawa. Sinasabi niya, Mommy, you're not my teacher. Parang sinasabi niya gano'n. Nahirapan din siya mag-adjust. Nasa adjusting period din yung anak ko.
Despite the deferment, the DepEd notes that face-to-face classes will remain prohibited. The department adds it is still discussing the date as to when the upcoming school year will end. For News 5, Jenny Dongon, We Are One News.
For more updates, follow News 5, the Philippine Star and Business World online. Visit our website, onenews.ph, for more in-depth analysis. And you can also catch One News on the Signal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime and anywhere. I'm Charles Lejano. We are One News.